Hi, it's Kim and Phil delivering a special episode on COVID-19, the virus that has caused a worldwide pandemic affecting 157 countries and territories. This is what we can share with you.
Welcome to the World Nomads Podcast, delivered by World Nomads, the travel lifestyle and insurance brand. It's not your usual travel podcast. It's everything for the adventurous, independent traveler.
And Phil, we're doing it from our wardrobes because we're not allowed to go to the office.
No, self-isolating.
Travel really has certainly changed in the past few weeks, with countries in lockdown, flights changed or cancelled, popular sites closed, and, as we just said, self-isolation rules imposed. And even as you're listening to this episode, a lot will be changing or will have changed in the country that you're in or that you plan to visit. It's incredibly quick.
It's moving so fast. So look, in this episode, we're going to address some frequently asked questions about the virus and how it may affect your travel. Speak to Liz, who's in lockdown in Italy, and chat with a dad living a nomadic lifestyle with his family and determined to keep travelling even though they're forced to constantly shift their plans at the moment.
First, though, Chief Medical Officer with the NIB Group, Dr. Melissa Nadeau, is here to remind us what the coronavirus is, the symptoms, who's at risk, and how do you catch or even avoid catching it.
So coronaviruses are a large group of viruses, and they generally cause mild illnesses in humans, such as the common cold. COVID-19 or COVID-19 virus is a new strain of coronavirus that's not been previously identified in humans. And because we've not been exposed to it, we're not entirely sure around how it operates, and a lot of the measures that we're taking at the moment are around ensuring that we protect people from this virus.
What are the symptoms then before we start talking about how you would catch it or how to protect yourself?
Yeah, so the symptoms are actually quite similar to other respiratory illnesses. So symptoms can include fever, flu-like symptoms, which are often cough, sore throat or fatigue for coronavirus, or shortness of breath. I think it's important to remember that most people, usually about 80% of people, will have minor, if any, symptoms. But there are a group of people who are more vulnerable and may develop more severe symptoms as well. The focus really for us is in trying to maintain good practices that prevent the spread, so that those people who are in a more vulnerable group, for example, the elderly, those with chronic disease, those in settings where there's close contact with other people, may be at more risk and may experience much more significant symptoms and also complications, including respiratory distress and pneumonia, that we protect them from the spread of the virus.
All right, well, let's talk about protection then. So number one is wash your hands, right?
Absolutely. So I think there are things that we can all do to ensure that we reduce the spread of the coronavirus to those that we care about. And absolutely, washing your hands. So practicing meticulous hygiene. Washing your hands regularly, and certainly before you eat or after you go to the bathroom or where you're interacting with people. And that's with soap and water for a good thorough wash for at least 20 seconds will certainly kill those germs and protect those that you're interacting with. If you don't have access to soap and water, you can use alcohol-based hand sanitizers, and that will do a good job as well. You need to make sure that you're covering your coughs and your sneezes with either your elbow or a tissue, and then dispose of the tissue properly. Also, be sure to be cleaning and disinfecting surfaces, because we are aware that the virus can survive on surfaces.
Handshaking, like reducing all that sort of contact as well.
I think we should definitely be thinking about reducing sort of skin-to-skin contact, so that's, handshaking. There's lots of other ways to say hello, and I've seen some really good posters and suggestions there about, different cultural ways to say hello that doesn't involve handshaking.
Do you know my favourite one of those somebody shared around? They said we should go back to, like Edwardian times, like in the Jane Austen novels, and the first person should bow to the other one, and the second person, regardless of gender, should curtsy.
I love it. I'll be looking for that.
Thank you, Melissa. That is COVID-19 in a nutshell. But Phil, what are some other ways you can greet people without touching? I'm really not convinced about that curtsying.
No, I'm going to do it though.
You would?
Look, yeah. Look, you can salute, touch elbows. You can wave, you could wink or do the namaste, which is popular in India and Nepal. And if you normally kiss somebody, the European kiss on a couple of cheeks, simply blow them a kiss through the air without touching.
It is hard because, reaching out to shake a hand is such second nature, isn't it?
Yeah, it is, yeah. Yep.
But we've got to do it. All great suggestions. Now, what are some of the frequently asked questions then from travellers regarding this virus?
Yeah, well, World Nomads, we've got a list of FAQs on travel insurance by country because we've got 6 different underwriters, so it varies from country to country. How does it affect your travel plans? Again, a list of helpful links in show notes, but here's some things you can do straight up. Look, contact your airline, your cruise line or your tour operator to check if their services are affected. Very likely at the moment. If you need to change your travel arrangements, contact those people, the airlines and travel providers, and ask them for assistance in the first place. Go to them first because they will have got things set up where they're already helping their customers as well. So see what they're doing. Then you need to refer to your World Nomads policy wording for more detail. Go to those FAQ pages before you try calling our contact centre because everybody's trying to do it at the moment and there's really, really long waiting times. We will get to everybody eventually, but sorry, you just have to be patient. Look, all policy terms, conditions, limitations and all those usual exclusions still apply. If you're injured or ill, contact the emergency assistance team as soon as you can. Look, their details are in your certificate of insurance and they're also on our website. One of the problems we're facing at the moment with high volume of calls is we're trying to clear that backlog as fast as we can so that genuine emergencies, health emergencies can get through. So that's another reason we want you to go to the FAQs. In the event of a claim covered by your policy, you must do everything you can to minimise and reduce the cost of your claim. And of course, you've got to provide all the supporting documentation, expenses incurred, receipts, all those sorts of things. If you intend to submit a claim, please complete the claim form. And if you need help doing this, then get in the queue, but we will be able to help you with that as well.
Thank you. And as Phil said, all that in show notes. Elizabeth Heath is a travel writer and editor based in central Italy. I mean, we're isolating ourselves, but our country
in a cupboard,
or state we live in, in a cupboard. We are not in complete lockdown, unlike Liz. Where are you in Italy, Liz?
I'm in central Italy, so I'm in the region of Umbria, which is we're about halfway between Florence and Rome. And everything's closed. So even if a tourist could come to Italy right now, there's not a whole lot to do here. Restaurants are closed, bars are closed, all monuments, museums, archaeological sites, everything's closed.
But what about supermarkets? Are they still operating? Can you get food?
Grocery stores and pharmacies, banks, I think tobacco stores. Probably. We don't really have liquor stores, but I'm sure if we did, they would be open too. Those have remained open. Post office, I don't know if I said that one. So any essential services, but you have to respect a 1 meter distance from anybody else in the same building space. And people are lining up outside of these businesses and staying in line a meter distant from one another, and then only entering, a few people at a time so that within the store or whatever the business, they can also respect that 1 meter distance. People are trying. This is the Italian people, the Italian government and medical community, everything has really demonstrated some courage in the face of this, to be quite honest. So people are trying. I mean, there's a certain amount of panic with people rushing to the grocery store to stock up on things. But so far as what we're being told now, the supply chain is not going to be interrupted. So there shouldn't be food shortages, medicine shortages, things like that. So if everybody stays calm, it's stressful, but I think we'll get through it.
So you can leave your house to go and buy food. That's not an issue.
If I leave the house to go buy food, I have to have a document with me, a form that I filled out that declares the purpose of my trip. And if I get stopped by Carabinieri, by the local police, they will look at the form, sign it, and then, let me go on my way. And my husband is going back and forth to his job site. He works in construction, and he's still allowed to go to work. And he, as of yet, has not been stopped. But if he is stopped, he has his document with him that says, hey, I have a justifiable reason. It doesn't feel scary in the sense that we're, fearing, a military coup or something like that. It doesn't, there's no sense of adversarial sense like us versus the government. It's not, I have to say, it's not that at all. If there's anything I could convey to people outside of Italy, it's just we're not on, some kind of martial lockdown with machine gun police roaming the streets, things like that. It's just not like that. It's just strange. It just feels strange that we have to stay inside or within the perimeter of our own homes pretty much. I apparently can go walk the dogs today. I did check on that, and I will be able to take the dogs out, but I think I have to take one of those papers with me when I go. Well, you know what? I don't mean to sound like Schadenfreude or harbinger of bad news or anything, but this is coming.
Yeah.
Coming for the rest of the world. And I imagine that other countries are going to look to Italy as a test case.
Are people working from home? You're still able to work?
I'm able to work because I work from home anyway. So it's not, it's probably been less disruptive for me than it has for a lot of people. The most disruptive thing for me is that my daughter's home from school and I have to keep her occupied and also try to be productive during the day. So, that's this is not, as hardships go, it could be a lot worse. Now they've closed all non-essential offices. So people who, like my husband, as I said, he works at a job site with just a few people, and they're out in the open, so he can go to work. But non-essential services have been told to stay home. And work from home isn't really a big part of the culture here yet, because there's not that many people, at least in the place where I live, that work in the technology sector, for example, or who have a type of work that is suitable for working from home. But I think a lot of people are going to be discovering that, it actually is possible.
I don't know if you've heard, but in Australia, there's been sort of panic buying in our supermarkets, and it's pretty hard to buy rice, pasta, and toilet paper, for heaven's sake.
Yeah, my niece lives in Sydney, and she says she can't find toilet paper.
I know. Yeah. And apparently if you want to buy hand sanitizer, you have to go into the chemist, and it's kept behind the counter. It's like you're buying methadone or something, So it's that sort of, level of craziness around shopping and hoarding in where you are?
I haven't seen, the only thing we've not been able to find here is hand sanitizer and antiseptic wipes. But that's been a month we haven't been able to find those. I've been making my own hand sanitizer at home.
What's your recipe? What are you doing?
Alcohol, rubbing alcohol, and I have aloe vera gel. Like we have I had some on hand for, sunburn. And vodka would work too. It's a, tragic waste of vodka, but it'll work. I mean, we need the vodka for other purposes right now.
Yes. If you're in lockdown for much longer, you're going to need it.
But, I wrote a blog, not a blog post, but I wrote a Facebook post about this a couple of days ago. We're not having the run on toilet paper, and I think it's because we have bidets.
I bumped into a guy at the local coffee shop the other morning, and he was obviously a tradesman, and he was wearing a shirt, and he was a plumber. And I said, mate, this is a great opportunity for you. Are you advertising bidet in a day installations?
Those bidets don't look so silly now, huh?
Yeah, that's right. But, okay, so there's no sort of, people marching around. It's not you versus the government. And you say there's, obviously anxiety in the air as well. But is there a bit of we're all in this together sort of camaraderie about it?
Very, very much so. I would say that, I can't say I have my finger on the pulse of all of Italy, but from what I have seen from the wider, social media community, from the groups, the mom groups with my kids' school and everything else, there is very much a sense of, yes, we're all in this together. And as much as this is disturbing and disrupting, it's also had a very unifying effect on the people of Italy, I would say. And there is trust in the government. Our government has been proactive, aggressive, and very, very transparent.
I feel really sad for the older generation because not only are they at risk, but they probably wouldn't have seen measures like this since World War II. And also, you can't go to mass. So is there anxiety amongst the older generation there?
I think so, and I certainly hope so. I hope people aren't taking it too lightly. We have been repeatedly scolding my mother-in-law to stay inside, to not have people coming in and out of her house, to not be doing the things that she's just used to doing. And we could fall ill with coronavirus, or we could catch coronavirus and be carriers of it and not know it. And our concerns are for our older relatives because they are so vulnerable, which is part of the reason we've had a relatively high death rate in Italy, is because we have such a high population of seniors.
Yeah, thanks so much for sharing, Liz.
It was fun to speak to other human beings.
Oh, good. Now you know our numbers. If you get lonely, just call.
Exactly.
You guys talk. I'm lonely.
Now, Liz mentioned that sense of camaraderie that exists in Italy as a result of the lockdown. And recently there was haunting footage of people across Italy singing the Song of Verbena, a traditional patriotic folk song, from their balconies. And that was to keep up morale and obviously because of social distancing.
I seem to have something in my eye, Kim. Sorry.
Me too.
Look, at a time of when we recorded this, Spain had locked down its citizens and France was locking down pretty much everything, including the Eiffel Tower, while in Iran they're struggling with the rising death toll. And the UK's thinking about imposing self-isolation for anyone over the age of 70.
And when you think about how travel impacts you, we have someone on our team who has her dad's in the UK and is elderly, and she feels that she might not be able to get to him. And
if something happens, she wouldn't even be able to get there. No, it's terrible.
Peter and his wife, Monica, they're from Vancouver in Canada. Now, they quit their jobs, sold their home, most of their possessions. They started travelling the world in June 2019. Obviously, it's very different now, Phil.
Look, it began with a cross-Canada road trip all summer long, tenting most of the way, with our kids who are 6 and 8. And in September 29 began the international leg of their journey in Asia. And we catch up with them in Vietnam, where they are monitoring the situation with the virus right now.
We're cautious. We're not so frightened about our own safety. As the oldest member of the family at 45, I'm still in a very low risk group. We have 2 kids, 6 and 8, and getting as much information as we can. But from everything that I've learned so far, children are at the least risk. Most of the time, they might not even show any symptoms. So they're more of a risk to transmit the disease than they are to suffer from it. And, we're relatively healthy people, and we're not health nuts by any stretch. Yeah, we're not so much concerned about our own personal safety. We're more concerned about how this is going to affect our travels and whether or not we're going to be able to get into a country and then be able to leave from that country or be quarantined and those sort of things. We've been in Vietnam since the 15th of February, so just the very beginning of the outbreak. We were in Hanoi, just outside a suburb of Hanoi, for about a month. And then we've been traveling south since then. So 2 weeks in Ninh Binh, and we've been in Da Nang for about 2 weeks, almost just under 2 weeks. So we've kind of seen the progression of things. And at first, Vietnam was one of the first countries with cases, but they cracked down quick. And it really is, at this point, is probably one of the safest places in the world to be. I think the latest numbers are 38 cases.
So what does that crackdown look like?
Well, at first in Hanoi, it was like we were in a condo in this place called Eco Park, which is a suburb, and it's sort of like a a recreation of a North American suburb. So lots of green space and quiet streets and condo towers and whatnot. So they started off with announcements 3 times a day, very loud throughout the whole building in Vietnamese. So we had no idea what they were saying, but our hosts gave us a translation. Basically, they're talking about people wearing masks all the time, and there were signs up that we also couldn't read necessarily. And hand sanitizer. Most of the residents were wearing masks, and it all happened during Tet, of course. So it was already a ghost town just because of Tet. So most of the businesses were closed for a week. That's the Lunar New Year celebration, and it's it's not a thing that should be a draw for anybody as an aside, because there's not really much way for tourists to participate. And so I think that helped mitigate the spread as well, because people were, more or less keeping it themselves. So there's hand sanitizer everywhere, and they were disinfecting the elevators 3 times a day. And there's a shuttle bus that you get on, and they would ask everybody to wear a mask on the shuttle bus. And literally every single person on that bus had a mask on. There's hand sanitizer as you're getting on and off the bus. We managed to get some masks, but most places sold out rather quickly. But we got some face masks and some hand sanitizer. And, it was still, there's still people going to the mall and things like that. And there's still people out and about. But then when we came to Ninh Binh, it seemed like they weren't concerned about it at all. And there was 3 weeks where there was absolutely no new cases in Vietnam. So we kind of relaxed for a while, weren't really thinking about it much, but still keeping track with the news. And then coming to Da Nang just about 4 days ago, a woman flew back from the UK. She's a Vietnamese woman who had been to Italy and had some symptoms but didn't tell anyone. And she was in business class. She spread it to a couple of people from the UK there, and they've spread it around a bit. So things have ramped up again, and very much everybody's wearing a face mask, which WHO says is not as an important a thing. They don't recommend people wear face masks unless they're infected or symptomatic. But you see people driving around in a car by themselves wearing a face mask.
Do you have plans to travel, obviously, somewhere else? You've got some plans. Where was going to be next, and have you kept those plans the same?
At the time being, we have. And it was the funny thing is that at the beginning of this, when we weren't as concerned about it, we planned our vacation or our travels up until Vietnam, and then we started making plans while we were in Hanoi for the rest of the summer, because we thought we got to start booking ahead before things get all filled up, which I don't think is quite a concern at the moment. Planned everything out almost till the end of October. So luckily, Airbnb has a good policy where they'll reimburse your money if it's plans have to be changed or canceled due to coronavirus concerns. Our next destination is Malaysia, and we're supposed to be traveling there in 2 weeks. And we actually had our flights in and out of Malaysia canceled, and I believe that was due to capacity, so they didn't have enough customers. So we rebooked our flight into Malaysia, and at a lower rate and a better time. So that was actually a benefit to some degree. And what we were just kind of holding off on booking our flight out of Malaysia because we might want to move that date up. We also had an Airbnb booking cancel on us in Kuala Lumpur. And he said that was due to coronavirus concerns. And that was quite a while ago when there was very few cases there. But we found another place in Penang at a better rate and really nice place at a discounted rate. So that was, I guess, somewhat of a benefit to us. So right now we're just monitoring the situation in Malaysia.
2 things, if I can. One is you will love Penang. It's awesome.
Yeah.
And the other thing is, what I'm wondering is we're in a situation now where it's about protecting the herd, the herd being all of global human population. Are you considering at all about, what consequence your actions may have, and are you sort of second-guessing yourself on that, or?
Well, maybe we didn't mention this earlier. My wife and I are both registered nurses. I think that we're fairly cautious compared to a lot of people, probably. we have experience with this. Like, we're used to not having to, like, not touching our face. So we kind of switch on this mode. Kids might be more of a concern, but, there's two of us, there's two kids. So, and, we spend a lot of time as it is just in our place. Like, we do go out and we do go to eat dinner and stuff, but I do think at this point that as long as we're very, very careful with hand hygiene primarily and monitoring our kids' symptoms and those sort of things, that we can mitigate those risks. And I don't think that we're putting any other people at risk at this point. And if things changed in that regard, then we would change our plans accordingly.
Thank you, Peter, who also says Worldometer is a great resource full of information about the virus in real time. You also mentioned one earlier.
Johns Hopkins University has got a site. Yeah, a really amazing sort of live graphic there, which is pretty interesting. Dr. Diana Bossio is a senior lecturer in media and communications at Swinburne University in Australia, and she's here to chat about the spread of false claims in response to COVID-19 and the anxiety that that's causing.
I think that most people who are reading the news daily are really feeling fearful and feeling that anxiety. And I think in that kind of context where there's this big, bad pandemic, people are trying to make sense of it. And one of the ways that people make sense of things is to question them. So I think that's a kind of normal reaction. The other thing, unfortunately, that we do see with these kinds of global events is that there is a spread of what we would call misinformation, whether it's accidental, so people trying to do the right thing and share information that they think is important but is later found out to be untrue, or there's that more kind of malicious and often politicised spread of misinformation that happens during these kinds of global events. And that spread happens for a number of different reasons. But yes, we do see what's now being called an infodemic, where lots of different contexts for information are being spread, and wrapping that up with other people's fears and anxieties. We do see information that's just not true. Everybody becomes a bit of an instant expert on stuff because they're all consuming it, don't they? Yeah, I think so. But also, I mean, it's understandable in a way, because I think that one of the wonderful things about social media really is that when something like this is happening, it's a way for us all to come together and actually share our anxieties and fears and our grief, because we do lose things in these kinds of situations. But that's a kind of double-edged sword, because people sharing anxiety but also sharing information and sharing what their mothers, brothers, sisters worked, that can have a negative effect as well. Can we get straight to a couple of maybe misinformation or myths around that? I bumped into a bloke the other day who said he's gargling with vodka so that he doesn't get it. And I said, mate, you're wasting good vodka there. Yes, he is. I would say save the vodka for the shutdown because he's going to need it to get through not being able to go out. But I mean, on a serious note, I think there are a lot of people sharing things that they say work for them, or in a more kind of negative frame, the sharing misinformation because they want to sell you something. We had the instance with Miranda Kerr, the model, Victoria's Secret's model, overnight. At the time of recording, who was deferring to the... You mean the model slashed immunologist? Well, she probably truly believes that taking or having a glass of celery juice each day does help you. I'm a media and communications expert, so I'm not the expert on juicing, but I would say that if the World Health Organization didn't put it on the website, it's probably not going to help you. Speaking of stars, Hollywood actor Tom Hanks is in quarantine here in Australia, and there are some false reports that you're suggesting around him that are doing the rounds? Yes. Actually, I'm going to be honest with you. I'm a little bit sad that this one isn't true. But the fabulous people at Batuta Advocate, which is a satirical news site, they do wonderful work. They shared an image of Tom Hanks with a ball with a face on it, and you'll know that that's quite
Wilson.
And I actually saw that emerge and thought that's so funny. That's a great way to find some humour in this situation. But then, of course, you start to see it on TV news programs, and of course it's not true, it's Photoshop. That kind of fake news, look, it doesn't have that huge an impact because it's kind of funny and you kind of feel like that's something Tom Hanks would do.
Yeah.
But as journalists, of course, you have to have a commitment to the truth, and whether it's harmless or not, there's an ethical decision that needs to be made in this kind of context. Are we going to share everything, or are we going to make decisions about the legitimacy of information so that we're not, accidentally alarming people.
Back to celery juice then and vodka. A steroid anti-inflammatory drug. Now, that's one I haven't come across yet. Is that being suggested as something that can protect you from the virus?
It has, and this is a huge issue because it was actually shared by a politician in France who said that anti-inflammatories would have a negative impact on people who were diagnosed with coronavirus or COVID-19 because it would mask the symptoms. And that was fairly quickly suggested to be fake. I think there is some suggestion by health authorities that there may be an issue, but it's certainly not something that you would be sharing if you didn't know. And of course, this individual politician did share it, and it was very quickly picked up. And of course, here's the problem: even when you go back and delete on social media, or even when you issue a correction, that's just too late. It actually really is hard to clear up a mistake once it's been shared. So that's the problem there.
Well, in closing then, for everyone listening around the globe, what's your advice on who we should be listening to?
I actually think that we need to think about being really good digital citizens and to really think about our own digital literacies. And that actually means not jumping on bandwagons. It means that we just take a moment. There's that share button, once you've shared, it's really fast. Things spread really fast. So when you read something, you need to stop and think, well, how does this make me feel? And is this making me feel kind of nervous? And who is saying this? And what's their reason for saying it? I know in this day and age, it's very fashionable to question our institutions. In the context of COVID-19, I would say that you trust the expertise that's published on the World Health Organization website, on government health websites in your area, and of course make sure that you're contextualizing that information so you're getting the information that's relevant to you in your location.
Yes, listen to the experts. But what can you do when you love travel and the pandemic has you sitting on the couch?
Well, you can take a virtual tour at over 500 museums and galleries around the world online. Try learning a language online too. And of course, there are plenty of great movies about travel and documentaries to inspire us when this is all over.
You can search for travel on Facebook. There's a long list of travel groups there that you can join, connecting you to fellow travel lovers. But as we heard with Diana, be a responsible digital citizen. And if you have any other ideas or would like to share how your travel has been impacted, email podcast@worldnomads.com. Now, a friend of mine, Erin Ramsey, who I worked in radio with, is in Japan. Now, as we know, restrictions are different based on what country you're in. We are here in Australia, and our travel restrictions mean that we cannot travel overseas unless it's absolutely essential. But it also means when you're coming back into the country as an Australian with an Australian passport, you have to isolate yourself for 14 days. Erin took off when none of this was in place.
Hey, it's Erin here. I'm currently spending 10 days in Japan, 5 in Hakuba and 5 in Tokyo. Just before I left, I was in contact with my HR managers and my newsroom managers, just talking about, what to expect. And they basically said to follow the Smart Traveller website. So I took off from Sydney and it was saying to head over there with caution. And as soon as I landed, that was red alert and do not travel unless you absolutely have to. So already in Japan, jumped on a shuttle, went down to Hakuba, and the overall vibe is pretty chill. A lot of Aussies in Hakuba, so that's been all right so far, and the snow has been epic, so that's a bit of a positive. But heading to Tokyo tomorrow, and from what I've heard, there's lots of things closed. A lot of the main tourist attractions will be closed, but it will be good to seek out the not so touristy places in Tokyo. I'm sure there's still going to be plenty to do and plenty of yummy food to enjoy, so that'll be okay. But it's going to be interesting heading home now after that and having to be self-isolated for 2 weeks. I'd love to work from home as a radio news journo, but I don't know if that's going to be possible. But, it's obviously for the best, and it's obviously a very safe decision. So, I'll just be mentally preparing for 2 weeks in a room, which is going to be very interesting. But it's pretty crazy time. It's pretty interesting to be over here when all of this is happening. Definitely in a once-in-a-lifetime situation. But definitely going to be interesting to see what happens in the next 5 days whilst I'm in Tokyo.
There's so much to talk about in relation to this virus, including the difference lockdowns have made to locations that are victims of over-tourism. Kim, did you see the pictures today? The canals in Venice have cleared up. They're like clear water now.
There's got to be a positive to this, hey?
Absolutely. Look, have you noticed a change in your area, the places where you go? We'd love you to share that with us as too. We're keen to get as many stories out there as possible.
Yeah, you're the people that are on the ground, and we'd love to share your stories. Keep well, and while it's not practical for travelling currently, don't quit your daydreams, Phil.
Absolutely not. Okay, bye.
Bye.
The World Nomads Podcast. Explore your boundaries.